Hello everyone, with this diagram we'll try to learn about the menstrual cycle, which includes the uterine changes and the changes in the ovary. Uterine changes has three phases, that is menstrual phase, proliferative phase and secretory phase, whereas the ovarian cycle it has a follicular phase, ovulatory phase and the luteal phase. The menstruation starts with the shedding of the endometrium, which occurs because of the sudden fall in the estrogen and progesterone levels after the secretory phase. And the GnRH, which is produced from the hypothalamus in low levels, it starts generating LH and FSH. Gradually, FSH is going to lead to the activation of the follicles, and finally one of the follicle it dominates, and it is going to start producing estrogen with the help of the luteinizing hormone. And so this luteinizing hormone acts on the theca cells. It produces androgens, and androgens get converted into estrogen. So there will be sustained levels of estrogen occurs, and that is going to lead to the positive feedback for the LH secretion, and there will be LH peak, and this LH peak is responsible for the ovulation. And upon ovulation, the follicle after the ovulation, the follicle starts degenerating, and it becomes corpus luteum, and this corpus luteum starts generating estrogen and progesterone. So immediately after the ovulation, the progesterone level they gradually increase, and then later they decreases, whereas estrogen level suddenly falls. Again there will be increase in the sustained levels of estrogen. The proliferative phase of the uterine cycle is caused by uh, the estrogen, where it is going to stimulate the formation of the arteries, and the vasculature increases, and hence the myometrial thickness is going to increase. In secretory phase, where the progesterone production predominates, and that causes the vasodilatation, and the vessels becomes tortuous at the end of the secretory phase. When estrogen and progesterone level suddenly falls, it starts the menstrual phase.